Do you know what's in your prescription pill bottle? Millions of prescriptions are filled every year, but sometimes there are mistakes, and there are times when a mistake can be fatal. In Canada, Nova Scotia is the only province where it is mandatory for pharmacies to report those prescription errors. For Melissa Sheldrick, well, this is unacceptable. Her 8-year-old son, Andrew, died last year after a prescription error. She is now pushing for legislation in Ontario to mandate pharmacies to report all errors and near misses. Melissa joins us in studio this morning, along with Dr. Neil McKinnon joining us from Ohio. He helped create Safety Net RX. That's the program that Nova Scotia pharmacies currently use to report prescription errors. Good morning to both of you.
Good morning.
Melissa, I want to start with you. Your son, Andrew, given the wrong medication. Do you know yet how that happened?
As far as we know, he was given the wrong medication because somebody picked the wrong bottle off of a shelf.
And this was not a new medication to your family?
No, it was a refill that he had been taking for many, many months, and we just picked it up as usual one Saturday and gave it to him Saturday evening, and one dose was 3 times the lethal dose for an adult.
You know, after going through the pain and the grieving, to find out that this was an error, tell me your emotions you went through then.
We had to wait 4 months before we actually found out that it was an error with the medication. It was the last thing we expected. It took us right back to the shock and the trauma of the beginning, and it made us angry, and we wondered how could this happen? And the idea that nobody would know about it because it wasn't mandatory that they would report this incident, it made me push so that this would have to become mandatory in this province.
You did what any good mom would do, is that you picked up the fight. You started a petition. It's gone international. Tens of thousands of signatures to enact Ontario legislation that pharmacies would be mandated, not voluntary, but mandated to report errors. Tell us what kind of progress has been made.
We've made wonderful progress. I met with Dr. Hoskins, Minister of Health and Long-Term Care in Ontario, and he was so supportive. He endorsed the College of Pharmacists to go ahead and put this program together, whereby there will be anonymous, mandatory incident reporting in Ontario to a third party so that they can collect the data, analyze it, and see exactly where the gaps are so that they can find strategies to help pharmacies so that fewer errors are made.
I want to get the reaction from the pharmacists in just a moment. But Dr. McKinnon, let's bring you into this conversation. Since your program, the one you created, Safety Net RX, started 6 years ago, here in Canada and Nova Scotia, more than 120,000 errors. 120,000 errors and near misses have been reported. Why do you think other provinces haven't mandated the same type of system of reporting?
Yeah, let me first extend my condolences to Mrs. Sheldrick and to her family, and also to thank her for being such a great advocate for patient safety in this country. You're right, Nova Scotia 6 years ago started this program. Of course, every province in Canada has a different college of pharmacists, a regulatory body, so it's really up to every province to tackle this subject. Certainly, we do know that the Nova Scotia experience has worked. As you mentioned, a lot of errors and near misses reported. The Nova Scotia pharmacists really being brave, being the first out there to report these things. And we've done a lot of research looking at, do the pharmacists feel their pharmacies are safer, more effective, and they do feel the program has worked. So it's great to see this activity in Ontario. Saskatchewan's done a pilot, PEI's done a pilot, so hopefully this will soon extend across the entire country.
Melissa, where in your research in putting together this petition, where did you find that some of the errors were happening within pharmacies?
We don't know exactly what happened that day. We know that there was a bottle that was either misplaced or it wasn't organized properly according to some of the reports that we've read. But I do know that pharmacies have a huge workload on their plates. They've got a lot of things to do. Vaccines and flus and patient consultations and long hours. So we want to keep working to see how we can improve workload conditions for pharmacies as well as find all of the gaps that we can to reduce human error.
Dr. McKinnon, how can people at home who are hearing of this story and of this situation, they need prescription medication. How can we as patients be proactive in ensuring that there are no errors with ours?
I think that the first thing is make sure you don't leave the pharmacy without speaking to the pharmacist. The analogy that I often use is the pharmacist is a hockey goalie, meaning that they're stopping errors from reaching the patient that the patient may never know about, but unfortunately some get through, just like a hockey goalie can't stop all the pucks. So the best thing a patient can do is to be informed, And how you can best be informed is to speak to the pharmacist, talk about the medication, know your own medications, know the common side effects, even look at the medication, ensure you got the right one. Again, do not leave the pharmacy without being an informed consumer.
In your case, Melissa, this is a medication your family was familiar with. It looked the same, right? I mean, this was something that was a mistake on behalf of the pharmacy. You know, you've taken up this fight. You're helping advocate for other patients. Do you know what's happening at the pharmacy where you received your prescription from?
Right now, it's in the hands of the college. They will examine it to see if there will be any disciplinary action, and if so, what that will be.
Melissa, I want to thank you for sharing your story with us.
Thanks for having me.
Our condolences on the loss of your son.
Thanks so much.
Dr. McKinnon, thank you for your work and for being with us this morning.
Great, thank you.
All right, to learn more about Melissa's petition, perhaps you want to sign it, you can visit our website at yourmorning.ca.